You're Lisa.
I am.
That's my
Hi.
sister's name.
It's a great name.
Yeah, she's a great gal, I'll tell you that.
Oh, great.
Yeah, well, it's so nice to meet you.
You too.
I see your diploma behind you. What does that say?
It's a Doctor of Education.
Oh, no way.
Yeah, I have a PhD in education. Yeah.
Right on. My mom was a PhD in child development because they didn't have education back then,
hmm
but she spent her life kind of teaching in education departments. And so you're an educator, huh? What's wrong with you?
Well, I'm a retired educator. Now I'm a firearm instructor. I thought I pulled a muscle and I lived with it for like 2 years. Finally went to my doctor who sent me to PT before an x-ray, which is excruciating. And I'm
Hmm.
doing topicals and I'm doing kinesio tape and I've gotten to tramadol 3 times a day. They finally did an x-ray and they're like, oh my gosh, you're like, there's no cartilage, you're bone on bone, and you have bone spurs. You need a hip replacement. Farthest thing from my mind. So I got online, did some research, did inquired in Phoenix spine and joint, and Phoebe called me and was wonderful. Double
Hmm.
checked insurance, everything in network. It turns out I had a friend that lived there that invited me to stay with her, and flew in, had it I think on Tuesday, Wednesday, day before Thanksgiving. Went back for my post up on Monday and flew home Monday afternoon. And 4 weeks later, I'm walking my two German Shepherds mile and a half. And then 10 months later, I'm in Ireland and I'm horseback riding and bicycling around Killarney National Park, and I'm hiking. And um, I'm just so grateful to Dr. Moore and Phoenix Spine and Joint, and everybody there has been awesome. I didn't realize how much pain I was in until the day after my surgery, because
When it went away.
it was nothing. The day
Yeah.
after surgery was nothing compared to what I went through, especially the last 6 months. Because my part-time job, I stand on concrete for 12 hours. And by the end of the day, I'm just limping and just hurting and don't want to say anything because I'm the oldest on the team. And I like my job, my part-time job. So
Yeah.
so when I walked into the Goodyear Center, and I'm like, I was with my friend was with me because my husband couldn't travel at the time, and I'm like, are we in the right place? I mean, this is like walking into a spa. I mean, they had leather furniture, they had TVs, they had flowers, they had carpet. I mean, it was just, it was surreal. I couldn't get over that
Hmm.
for the first little bit. And then when they took me in the back and got me ready, everything was really efficient, met the team. So I wasn't, I think I was still kind of in a surreal, so I wasn't scared or anything. And
Hmm.
I've had two other joints replaced before, a knee and a
Hmm.
shoulder. This was by far the easiest,
Hmm.
least complicated, best surgery. Don't, yeah.
Um, and then was it painful afterwards, or was your pain controlled? What was that like for you?
The pain was controlled, and I had learned through experience not to wait until you're in excruciating pain to take the pain
Right.
pills.
Right.
I don't smoke or drink, and I've never taken illegal drugs, so I've always had this in the back of my mind. I don't want to get hooked on any drugs. And
Yeah.
previous times I've stopped the pain pills too early. So Dr. Moore and I had discussed it before my surgery, to take it as prescribed the first couple of days and then wean off after that. And that's what I did. And I don't even think I used the walker. Was it a walker? Yeah, the first day, first and second day. Then that was it.
Months later, you were on vacation in Ireland.
From Ireland, Scotland, and England for a month.
Oh my
Yes.
gosh.
Yeah.
That
No,
sounds like the trip of a lifetime.
it was. I'd planned it 5 years ago, and Ireland was wonderful. I wasn't sure about getting on a horse because I knew other people that had hip replacements
Yeah.
that weren't allowed to do it. And I contacted Dr. Moore and Phoebe before, and they said, no, no limit, you're fine. You can bike, you can horseback ride. And,
Yeah.
granted, it was a slow walk on a beach. And then Killarney National Park was uphill and downhill on a rented bicycle for 2.5 hours. I was able to do that. Scotland, we had this one hike up to it's called the Giant's Thumb, and I swear it was like doing a hour and 20-minute stair stepper up. I mean, it was hard, the hardest thing I've done in a long time. And then I got to the
Hmm.
top, and I'm like, if I trip, I'm going all the way down. And I did it, and my hip never hurt the whole trip.
Yeah.
Yeah.
Well, Lisa Martinez, I really thank you for sharing your story. I'm so glad it went well. It almost always does, nearly every time. And um, I'm so jealous of that trip you got to take to England, Scotland, and Ireland. But if you need anything in the future, we're here. Just let us know.
Well, I do have to tell you, I sent my husband there last November, and he had his hip replaced by Dr. Moore last November. So,
Good.
yeah,
Same hip or the other one?
he's got the opposite hip.
Well, you guys can stand next to each other then and have your hips on it.
Yeah, exactly. Definitely. So I tell people, check Phoenix Spine and Joint. If you have to get a joint replaced, check there. They're taking most of the insurances. It's worth the trip. It's worth whatever you have to go to get it done there and not here. Just a real short story. Somebody I know got a traditional hip replacement here in Albuquerque the week before mine, and she was still on her walker when I was walking my German Shepherds. She still
Oh,
couldn't walk
yeah.
without a walker. So, I just the type of surgery, the surgeon, everybody there at Phoenix Spine and Joint, especially Phoebe, Dr. Moore, just awesome. Really made the procedure easy.
It's worth the trip, huh?
Oh, absolutely. Yes,
I'm so glad to
definitely.
hear that. Yeah.